Can you recall the time before the world knew of COVID-19? A time when life was simpler, carefree, and much more predictable. A period when the world was an open playground, when the joy of travel was unrestricted, and exploring different cultures was just a flight away. Remember the buzz of crowded markets, the warmth of a friendly handshake, the joy of a shared meal, or the roar of a live concert? We moved freely, breathing in life without the barrier of masks. We were physically close, gathering in groups without the fear of an invisible enemy. The simple pleasure of a shared laugh, a group hug, a high five, all taken for granted. Offices were bustling with energy, classrooms echoed with the chatter of students, and coffee shops were abuzz with friendly banter. Our realities were vastly different, and the phrase social distancing was unheard of. Little did we know, a significant change was on the horizon. In late 2019, whispers of a novel virus began to circulate. It was a murmur at first, a distant rumble of a storm brewing on the horizon. From a seafood market in Wuhan, China, a new threat to global health emerged, quietly seeping into the fabric of our everyday lives. As we bid farewell to 2019 and welcomed the new year, the whispers grew louder. The World Health Organization declared the novel coronavirus a public health emergency of international concern on January 30, 2020, and by March, the murmur had turned into a roar. The virus, now known as COVID-19, was declared a global pandemic. The world's response was swift and unprecedented. Governments around the globe enforced lockdowns, borders were shut, schools, offices, and public spaces were deserted as we retreated into our homes. The world as we knew it had come to a standstill. The rhythm of life was replaced with an eerie silence, punctuated only by the persistent echo of news updates and rising case numbers. Amidst the sudden shift, there was a palpable sense of panic and fear. Grocery store shelves were stripped bare as people prepared for the unknown. Hand sanitizer and face masks became commodities more precious than gold. The world was gripped by a fear of the invisible enemy that was COVID-19. But with fear came a race for information. Scientists, doctors, and researchers around the world dove headfirst into understanding this new virus. Every day brought new insights, new statistics, new guidelines. The world was learning together, fighting together, against a common enemy. Yet, in the midst of this chaos, there was a strange sense of unity. We were all in this together, navigating our way through uncharted waters. We clapped for our healthcare workers, we checked in on our neighbors, we found ways to connect and support each other. In the blink of an eye, life as we knew it had drastically changed. The world had shifted on its axis, and we were left grappling with the reality of our new normal. As days turned into months, we found ourselves adapting to a new normal. This wasn't a choice, but a necessity, a survival instinct kicking in. Our world was reshaped by an invisible enemy, and we had to change our ways to fight it. In this new reality, masks became more than just a piece of fabric. They transformed into our shields, our first line of defense against the virus. We wore them as we braved the outside world, and they became as essential as our keys and wallets whenever we left our homes. Social distancing, once an alien concept, turned into a common practice. We swapped handshakes for nods, hugs for waves, and crowded places for the safety of our homes. It was strange at first, but soon it became second nature. Our homes, once a sanctuary from work, morphed into our workplaces. Kitchen tables became desks, living rooms turned into conference rooms, and our co-workers became our pets or family members. The lines between work life and home life blurred, and we found ourselves juggling multiple roles at the same time. Education, too, saw a significant shift. Schools adapted to the situation with virtual learning, turning bedrooms into classrooms. Students swapped their school bags for laptops, and teachers adapted their lessons to fit the screens. The professional world, too, underwent a transformation. Business meetings moved online, and networking events turned virtual. We swapped business cards for LinkedIn profiles and office chatter for chat room banter. In the midst of all these changes, we found new ways to connect, to work, to learn, and to grow. We discovered the strength of human resilience, the power of adaptability. But this new normal wasn't without its challenges. We traded physical connection for safety, we swapped office culture for isolation, we exchanged classroom camaraderie for screen fatigue. We had to adapt, to survive, to keep going. But as we navigated this new landscape, we couldn't help but wonder. We had adapted, but at what cost? While our physical health was at risk, the silent toll on our mental health was equally alarming. As we navigated through uncharted territories, the isolation, fear, and uncertainty left a profound impact on our mental health. The once bustling streets turned into ghost towns, and our homes became our sanctuaries, our workplaces, and our classrooms. Our usual routines were disrupted, and we were forced to adapt to a new way of life. This drastic change was not easy for everyone. The isolation from loved ones and the lack of social interaction led to a sense of loneliness and despair. Uncertainty, too, played a significant role. The unpredictable nature of the virus, coupled with the constant barrage of news about rising cases, created a state of constant fear and anxiety. The worry about contracting the virus or the fear of losing loved ones to it was a daily struggle for many. On top of this, the economic impact of the pandemic added another layer of stress. Job losses, financial instability, and the fear of an uncertain future were all contributing factors to the rise in mental health issues. Reports of anxiety and depression surged during this time. The number of people seeking help for mental health conditions increased significantly. This increase was not limited to adults. Children and teenagers too were grappling with their own set of challenges. The closure of schools and the shift to online learning, along with the lack of peer interaction, had a profound impact on their mental well-being. Healthcare workers, the frontline warriors, were not spared either. The constant pressure, the risk of exposure, and the emotional toll of seeing patients suffer added to their mental stress. It's important to remember that mental health is as crucial as physical health. Our mental well-being had become a casualty of this invisible enemy. As we continue to fight this pandemic, let's ensure that we also address and support the mental health needs of our communities. Because after all, our mental well-being had become a casualty of this invisible enemy. In the face of adversity, human spirit and scientific progress shone through. As the world grappled with the realities of the pandemic, a collective effort was underway. Scientists, healthcare professionals, and volunteers globally were tirelessly working, racing against time to develop a weapon that could turn the tide against this unseen enemy. The world needed a vaccine. In less than a year, a feat which was once thought to be impossible was achieved. Vaccines were developed, tested, and approved for emergency use. This was a testament to the power of human resilience and ingenuity. It was a moment of triumph in a time of despair. The distribution of the vaccine was a massive undertaking. It was like gearing up for a global war. But this time, the enemy was a microscopic virus. The logistics were complex, the challenges were many, but the resolve was unwavering. From the bustling cities to the remote corners of the world, vaccines started reaching people. Healthcare workers, the elderly, the vulnerable, were given priority. The process was slow, but the wheels were turning, and there was a sense of progress. The availability of the vaccine brought with it a glimmer of hope. It represented a potential return to the normalcy we once knew. It meant the possibility of hugging loved ones without fear, of children returning to school, of businesses reopening, of life resuming its rhythm. But it wasn't just about returning to normal. It was about building a new normal, a safer and more resilient world. A world where we are better prepared for such challenges. A world where science, cooperation, and compassion are valued more than ever. Even as we navigated the challenges of vaccine distribution and faced the realities of vaccine hesitancy, the beacon of hope never dimmed. The world had come together in an unprecedented way, and that in itself was a victory. As we rolled up our sleeves to receive the vaccine, we were not just protecting ourselves but also our communities, our loved ones, and our future. We were part of something bigger, a global movement of unity and resilience. The vaccine was a beacon of hope in the darkest of times. As we stand today, how has life changed in the aftermath of COVID-19? The world has seen a profound transformation. The pandemic taught us lessons that have changed our way of life, perhaps forever. One of the most evident changes is our heightened focus on hygiene. We've become more conscious of our health and the health of those around us, washing our hands more often and wearing masks when necessary. We've also seen a shift towards remote work and learning. Businesses and schools adapted, and we've found that many tasks can be accomplished just as efficiently from our homes. This flexibility has opened up new possibilities and opportunities for many. Lastly, the pandemic underscored the importance of mental health. We've recognized the need to take care of not just our physical health, but our emotional well-being too. Conversations about mental health are now more open and accepted than ever before. In the wake of COVID-19, our resilience has been tested and we have emerged stronger, ready to face whatever comes next.